Hello there, my friend. Hope you're doing great. For those who do not know me, my name is Christine and I will be conducting or instructing today's training. Today's training is all about California Senate Bill 855, which is the Mental Health Parity Expansion Law, which was enacted in 2020. This expansion to California's mental health parity law is especially important as the nation faces an astonishing rise in the need and utilization of mental health and addiction services. So, to demonstrate how elevated this issue really is, SB 855 cites the following. 1 in 5 adults in the US is cited as experiencing a mental health disorder, and 1 in 13 persons 12 years or older experiencing a substance use disorder. Between 2012 and 2017, California's rate of fatal overdoses for all opioids increased by 22%, while fatal overdose rates increased 85% for heroin and 425% for fentanyl. Suicide rates in California increased by 14.8 between 1999 and 2016, with the suicide rate from 1991 to 2017, inclusive of children 10 to 14 years of age, increasing by 225%. 37% of students with a mental health condition 14 years and older drop out of school. And mental illness has the highest dropout rate of any disability group. The correlation between untreated mental illness, substance use disorder, and incarceration is substantial, as 3 in 4 persons in jail have been diagnosed with a mental illness and a substance use disorder. Untreated mental health and substance use disorders are an enormous problem with incarcerated youth, with 70% of youth arrested each year having a mental health disorder. As many as 1/3 of the 130,000 persons who are homeless living in the streets in California have a mental health condition. Okay, my friend, those numbers are staggering. I don't know about you, but I was left speechless when I read through those numbers. They are astounding, and this mental health parity expansion law is definitely needed at this time. So we have lots to discuss, my friend. So let's get straight to it. Thanks for being here and looking forward to hearing from you.
Well, hello there. So let's just get straight to it and talk about California Senate Bill 855, the Mental Health Parity Law. So, in this particular lesson or training, you will learn the following: the impact of Senate Bill 855, an overview of Senate Bill 855, a brief background on mental health parity, an overview of sections 1374.72 and 1374.721 of the California Health and Safety Code, and what to look out for effective January 1, 2021, as this particular law goes into effect on this particular day. So let's get straight to it, my friend. So let's talk about the impact of Senate Bill 855. So this particular bill or law is applicable to commercial health benefit plans. So if you have any patients or if you're a health plan, this particular bill is applicable to health plans that offer commercial benefits or to patients that are under a commercial plan. And also, this particular bill impacts specialized healthcare plans that cover mental health, substance use disorder. So, if you are a provider of mental health or substance use disorder, you want to pay close attention to this particular bill. So, a quick overview of SB 855. But before we go into that, let's talk about what areas are not applicable under this particular bill. So, medical managed care plans would not be affected by this bill. Medicare Advantage plans will not be affected by this bill. Medicare supplemental plans will not be affected by this bill. So, any patients that are covered under a medical managed care plan, a Medicare Advantage plan, a Medicare supplemental plan is not covered under this particular bill. However, let's go back to who is covered. Again, the commercial health benefits plan types are covered, and the specialized healthcare plans that cover mental health and substance use disorder. Okay, now we can go straight into an overview of SB 855. So, this particular bill again is effective January 1, 2021. Senate Bill 855 repeals and replaces Section 1374.72, and in addition, it adds Section 1374.721 and 1367.045 of the California Health and Safety Code. So, a little background on mental health parity. Sections 1374.72 was enacted back in 1999, and this section of law required coverage of all diagnoses and medically necessary treatment of 9 listed severe mental illnesses, as well as serious emotional disturbances of a child. So, SB 855 seeks to expand upon the original mental health parity requirements to ensure adequate coverage for mental health and substance use disorder. So let's dive into the actual sections of law that this particular bill covers. So we're going to look at sections 1374.72 as well as sections 1374.721 of the California Health and Safety Code. So let's start off with sections 1374.72. So this particular section of law requires all healthcare service plan contracts issued or renewed as of January 1, 2021 that provides hospital, medical, or surgical coverage to provide coverage for medically necessary treatment of mental health and substance use disorder under the same terms and conditions applied to other medical conditions as specified in subdivision C of section 1374.72. And subdivision C, for your own reference, states the following: the terms and conditions applied to the benefits required by this section that shall be applied equally to all benefits under the plan contract shall include, but not limited to, all of the following patient financial responsibilities. 1. Maximum annual and lifetime benefits, if not prohibited by the applicable law. 2. Co-payments and co-insurance. 3. Individual and family deductibles. 4. Out-of-pocket maximums. So, in essence, whatever terms and conditions apply on the medical side of business must be the same terms and conditions that apply on the mental health and substance use disorder side of business. So there is parity between what a patient receives with their medical benefits and what they are receiving on their mental health and substance use disorder benefits. So, what is the definition of mental health and substance use disorder as required by this section of law? So, this particular section of law defines mental health and substance use disorder as a mental health condition or substance use disorder that falls under any of the diagnostic categories listed in the most recent edition of the International Classification of Diseases, ICD, or Diagnostic and Statistical Manual of Mental Disorders. And let's go ahead and define medically necessary treatment of a mental health or substance use disorder as defined by this section of law. So, for this particular section of law, you want to pay attention to the following definition: a service or a product addressing the specific needs of that patient for the purpose of preventing, diagnosing, or treating an illness, injury, condition, or its symptoms, including minimizing the progression of that particular illness, injury, condition, or its symptoms in a manner that is all of the following. Pay attention to that. All of the following. In accordance with the generally accepted standards of mental health and substance use disorder care, clinically appropriate in the terms of type, frequency, extent, site, and duration, not primarily for the economic benefit of the healthcare service plan and subscribers or for the convenience of the patient, treating physician, or other healthcare provider. So, this definition of what is medically necessary treatment of a mental health and substance use disorder is key in our advocacy for medically necessary treatment or care for a particular patient. So, if you're a provider listening to this, pay close attention to this. And we do have a workbook available that you can actually reference back on. So you don't have to master everything we're going to cover here. We have your back. Okay, let's talk about medical necessity determinations. So, all medical necessity determinations made by a healthcare service plan regarding services, intensity, level of care placement, continued stay and transfer or discharge of patients diagnosed with MHSUD or mental health or substance use disorder must be performed in accordance with the requirements of Section 1374.721, which we will get to in just a little bit. So hold off. Be patient, we're going to get to it. So let's talk about authorization. So once a healthcare service plan authorizes a particular treatment or service for a patient, this is what the law says. A healthcare service plan that authorizes a specific type of treatment by a provider pursuant to this section of law shall not rescind or modify the authorization after the provider renders the healthcare service in good faith and pursuant to this authorization for any reason, including but not limited to the plan's subsequent rescission, cancellation, or modification of the patient's or subscriber's contract, or the plan's subsequent determination that it did not make an accurate determination of the patient's or members or subscribers' eligibility. This is very key because we see a lot of authorizations rescinded that fall under this particular category after the healthcare provider has rendered services. So when you're advocating for a claim to be paid, and this would go through your provider dispute process, you would want to really pay close attention and cite this section of law to make sure that the healthcare service plan definitely overturns that particular improper denial, because that's what it would be. Once they authorize services, they cannot rescind or modify it, okay? Even based on the fact that they later on discover that the patient's eligibility was not as they had originally determined, okay? And if you are a healthcare service plan, pay close attention to your internal processes, your policies, and your procedures. Make sure that they are reflective of this particular section of law to minimize improper denials from happening. So let's talk about one interesting fact that really just got me about SB 855, and that is the out of network coverage requirement. So Section 1374.72D requires coverage for out of network services for medically necessary treatment of a mental health or substance use disorder when services are not available in the network with the geographic and timely standards. Again, when you're a provider or if you're a provider of care and a patient is deemed eligible for services out of network under this particular section of law, if a healthcare service plan cannot meet the geographic or timely access standards that determine how quick a member or a patient can see a doctor, then they need to arrange and authorize out of network coverage for that particular patient. So pay close attention to this. And if you're a healthcare service plan, make sure your policies and procedures internally are reflective of this out of network requirement so that we don't have claims denying inappropriately and the members' services being delayed because they cannot access an out of network coverage or an out of network provider. Okay, so we want to pay close attention to this area. So let's talk limitations. Let's talk limitations of benefits. So section 1374.72H prohibits plans from limiting benefits or coverage for medically necessary services on the basis that those services should be or could be covered by a public entitlement program. Again, make sure as a healthcare service plan that your internal processes really outline this prohibition so that we are not denying care based on the fact that we believe or we deem that that particular service could be or should be covered by a public entitlement program. Okay, that improper denial would delay services to a member and could cause, you know, financial burdens that are unnecessary. So, as a healthcare service plan, please just have your processes aligned to this section of law and your evidence of coverage or any other contract that outlines the benefits that a plan member receives, any limitations or any other area in that evidence of coverage or member handbook that has any sort of contradicting language under limitations, please make sure that they are aligned to this section of law. Okay, my friend, let's talk about sections 1374.721 of the California Health and Safety Code. So let's start off by talking about medical necessity determinations. So this is an added section of law that requires healthcare service plans that provide hospital, medical, or surgical coverage to base medical necessity determinations or utilization review criteria on current generally acceptable standards of mental health and substance use disorder care. Let's talk further about criteria and guidelines because that is a key area of the determinations made for medically necessary services. So, the section of law requires that a healthcare service plan must apply the most recent criteria and guidelines developed by the non-profit professional association for the relevant clinical specialty when conducting utilization review of treatment of mental health and substance use disorders. For example, locus calocus, ASAM are some of the examples of criteria and guidelines that a health plan may choose to adopt. And a health plan is also required to conduct formal education on clinical review criteria. So, this particular section of law requires a healthcare service plan to sponsor a formal education program by nonprofit clinical specialty associates to educate staff and third parties, including any third party contracted by the healthcare service plan, to review claims, conduct utilization reviews, or make medical necessity determinations about the clinical review criteria. So, very, 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 very important. I think this is a really good provision in the law to make sure that everyone that is subject to utilization review decisions or is subject to processing claims and making any sort of clinical determinations that pertain to mental health and substance use, that they have this particular training in front of them for this, so they can apply the decisions accurately across the board. So as a provider of healthcare, and if you fall under this particular category, if you provide care to a commercial patient, or if you're contracted to provide care with a specialized healthcare service plan that provides mental health and substance use disorder kind of treatments, watch out for this training. I know health plans are actively working to get all these requirements on SB 855 implemented and ready to go come 1/1/2021. So if you haven't been notified of an upcoming training, feel free to reach out to the provider relations area or the provider services team and find out when you can expect to get invited to receive this particular formal training, or find out through the website or any other resources that the healthcare service plan has made available, maybe through the provider portal, as I know sometimes health plans do provide some announcements in there. So, this particular section of law also requires healthcare service plans to make the education program available to other stakeholders, including the healthcare service plans participating providers, which we've just talked about, and even covered lives. You know, any patient, any member that is in need of this information, in need of this education program, should have that ability to be able to access it. So watch out. I know health plans will likely post this on their websites for public access, so you can also watch out for those updates to the website. Participating providers are not required to participate in the educational program, but I highly recommend that if you are contracted with one of these healthcare service plans, that you do attend at least one session. Because if you're contracted with multiple healthcare service plans, you might get several invites, but try and attend one, or have your staff who are responsible for making sure that a patient gets access to care attend this training as well. So let's highlight some definitions that the law in this particular section has highlighted, because I think it's very important that we get these definitions wrapped around our fingers so that when we are advocating for medically necessary healthcare services, we have these definitions as a backup to whatever it is that we are seeking, an overturn of a denial of some sort, if we are seeking authorization for a particular service, that we are able to use definitions under the law to justify, where necessary, uh, our requests for medically necessary services. And if you're a healthcare service plan, please make sure that your definitions in your policies and procedures align to the section of law that we are referencing right now. So let's talk about generally accepted standards of mental health and substance use disorder care, which was cited under sections 1374.721 of the California Health and Safety Code. So this means standards of care and clinical practice that are generally recognized by healthcare providers participating or practicing in relevant clinical specialties such as psychiatry, psychology, clinical sociology, addiction medicine and counseling, and behavioral health treatment pursuant to sections 1374.73. Valid evidence based sources establishing generally accepted standards of mental health and substance use disorder care include peer reviewed scientific studies and medical literature, clinical practice guidelines, and recommendations of nonprofit healthcare provider professional associations, specialty societies, and federal government agencies, and a drug labeling approved by the United States Food and Drug Administration. Okay, let's talk about mental health and substance use disorder definition. It has the same meaning as that defined under sections 3074.72 subdivision A, which states as a mental health condition or substance use disorder that falls under any of the diagnostic categories listed in the most recent edition of the International Classification of Disease or Diagnostic and Statistical Manual of Mental Disorders. Let's talk about the definition of utilization review, which means the following: one, prospectively, retrospectively, or concurrently reviewing and approving, modifying, delaying, or denying based in whole or in part on medical necessity, requests by healthcare providers, patients, or their authorized representatives for coverage of healthcare services prior to, retrospectively, or concurrent with the provision of healthcare services to patients. B, evaluating the medical necessity, appropriateness, level of care, service intensity, efficacy, or efficiency of healthcare services, benefits, procedures, or settings under any circumstances to determine whether a healthcare service or a benefit subject to a medical necessity coverage requirement in a healthcare service plan contract is covered as medically necessary for any enrollee or patient. And the definition of utilization review criteria simply means any criteria, standards, protocols, or guidelines used by a healthcare service plan to conduct utilization review. So, another point I want to make here: whenever a health plan conducts a utilization review, and makes a final determination, they are required to include the criteria by which they reached their decision. Okay. And they are required to cite that in the determination letter. So if you receive a denial determination, it should cite the particular criteria the plan used to reach that particular determination. So watch out for that. And if you, as a healthcare provider, are not in agreement with that particular determination, please utilize the appeal processes to get those particular to get that request for medically necessary services reviewed on an appeal level by a different medical director. It has to be reviewed by someone else who had no involvement with the original determination. In this case, the original denial. So, what can we look out for effective 1/1/2021 as it pertains to implementation of SB 855? So, let's watch out for an update as applicable to the medical necessity definitions to comply with Section 1374.72. So, as a healthcare provider, watch out for policies and procedures or definition changes that will be coming out to you or should be coming out to you from your particular contracted healthcare service plans, letting you know the revised definition of the medical necessity definition. And another area to watch out for is a revised definition of medical necessary treatment of a mental health or substance use disorder to comply with sections 1374.72A3. So, if you're a healthcare service plan, make sure your policies and procedures are updated again to reflect these updates by law. So let's watch out to, we can also expect to see a revision to the utilization review criteria and requirements and definitions to comply with sections 1374.721. And also to watch out for our utilization review policies and procedures we've talked about that should change to accommodate this section of law. If for some reason the policies and procedures are not impacted, that's great. But if they are, please take a second look at all your utilization management policies and procedures and apply the updates as necessary. And let's also watch out for updates to the evidence of coverage anywhere where a member's benefit is listed that provides the member with information that lets them know what is covered and what is not covered. That usually goes by the term evidence of coverage. Other terms used for that particular document is a member handbook. Whatever it is that a healthcare service plan is utilizing, they need to make sure that the evidence of coverage or member handbook is reflective of the law, and in addition, notify the members of the changes to the evidence of coverage so that they are aware that their benefits determinations are changing based on SB 855. So, provider contracts might be impacted. So, if you're a provider of care, watch out for a revision to your provider contracts as deemed necessary. And again, I indicated that whenever a health plan makes a determination of some sort, the communication back to the provider or the enrollee should let them know what they use to base their decisions on. So the criteria guidelines, So when the healthcare service plan will be citing their particular criteria or guidelines that they used to make their determinations, they should have revised those particular notifications to align with this particular section of law. So make sure that if you are receiving any notices as a provider effective 1/1/2021, that you are looking at the criteria and guidelines closely to make sure that they are really utilizing the criteria and guidelines that they should as a healthcare service plan. So again, let's talk about out of network coverage, because as of 1/1/2021, when a healthcare service plan is not able to meet a patient's need within their geographic area and also within the timely access standards requirement, they are required to comply with out of network requirements as stated in this section of law, meaning the patient is required to be able to access out of network providers. So if you're an out of network provider submitting claims and it's being rejected based on the fact that the member should have received coverage in network as opposed to out of network, well, if it was the case that in network coverage was not available for that particular member, and that is the reason why the member saw an out of network provider, that claim should be processed and overturned. So, as a healthcare service plan, again, make sure your processes are aligning with the law. And as a healthcare provider, make sure your processes too are aligned with the law so that when you're advocating for a claim dispute of some sort based on out of network as opposed to in network, and it falls under this particular scenario, that you're able to use the law to defend your particular request for a dispute to be uh, for a claim to be reprocessed. Okay. Okay, so we talked about formal education. Watch out for formal education and programs and resources that should be coming out from each healthcare service plan that is contracted or provides commercial services or is a specialized healthcare service plan that provides mental health and substance use disorder. Okay, my friend, that is a quick overview of SB 855, and we have come to the end. You have done great. We want to just make a few announcements, or we want to just take this opportunity to talk about a few things. So, we have an upcoming masterclass that will be starting in January. So, more details on the masterclass is available on our website. So check out our website www.babuhealthcareadvocates.com for more information and join us. You do not want to miss this masterclass as a healthcare provider. Especially, we will be going through claim disputes. We'll be going through how to identify and resolve improper clinical denials and so much more. So you want to make sure you register for that. And also, if you register on our website, you will be notified of the upcoming open enrollment to our online healthcare academy. So, again, if you don't register for the upcoming masterclass, still register to be included and subscribed to our notifications so that when we open the enrollment for our upcoming online healthcare academy, you will not miss out because this is a comprehensive look into how to identify and resolve improper denials. We're talking about step by step by step. We're talking about looking at appeal strategies, techniques on how to write your appeals. We're looking at templates that you can use for your appeals and how you can create your own templates by strategically aligning the law to your appeals. It's going to be an amazing academy that is going to go on for a 10-week period. So watch out for that. You don't want to miss out for that. Enrollment is limited. So you want to make sure your name is subscribed to our list so that when we send out the notification, you are aware and you do not miss out on that. Okay, my friend, it has been great holding this session with you. You guys are doing great. Reach out to us if you have any questions. You can always reach out to us at support@babuhealthcareadvocates.com. And also, we did mention that we have a workbook that goes together with this particular training. So make sure you grab the workbook in our website as well, where this training is uploaded under the masterclass section. You will see the PDF section as well, and you can grab yourself a copy as well. So, again, thank you so much for your attendance. Looking forward to talking to you soon. Ciao.